So, on to our campfire chat, and we're going to talk about vaccines and what do they mean to cross-border travel in Asia. I never thought in my career that I would actually be interviewing a doctor on stage. So we're very pleased to have with us Dr. Walter Lim, who's Deputy Country Managing Director, Singapore, and Managing Director for Clinical Services Singapore for Fullerton Health. Hello, Doctor. How are you?
Good. Thank you for having me on the show. It's been a while. I can't say I've been on many travel shows, but it's a pleasure to be here tonight.
Right. Are you a big traveler?
I am, and I like to travel in the region. Early on, there was some talk about going to winter destinations. I would really love to go to a winter destination right now.
As well, huh?
Yes. So my choice would be Hokkaido, and
Hokkaido.
That would be my choice.
All right. Well, we're all counting on you,
Yes.
on the medical profession, to help us open borders so that we can all go to the places of our dreams, right?
Well, there is cause for some optimism. Just to share, here in Singapore, sitting here in Singapore, we are quite privileged. Even as an organization, just one day ago, we have crossed our 200,000 mark in terms of vaccines administered. And just to share, I think we're also starting to host some international events. So we're providing medical support of late. Most recently, actually now, to an e-gaming event. Hopefully a golfing event soon, in next month.
Yeah, I heard the e-sports event is happening.
Yes.
And actually, it was interesting because yesterday I was at a conference here.
That's right.
For like 500 people, and
Yes.
I didn't have to do my antigen rapid test.
Yes.
Which was,
It's great.
such a relief.
The government in Singapore, I think they're really becoming a bit more flexible.
Okay.
And that is a good thing. But it's a sign of the confidence level here in Singapore, and I think there is cause for some confidence in the markets which are at the same stage as Singapore,
Right.
in Southeast Asia.
But unfortunately, those are few and far between. I think Singapore is very much an exception, kind of an outlier. And we're talking about the vaccine rollout across
Yes.
Asia. And I saw a chart that actually, it may not be till 2024 to 25 when poorer countries in the region are vaccinated. So are we
Yes.
sort of foolish to think that vaccines are the light at the end of the tunnel?
Well, just to share, I have colleagues in Philippines and Indonesia. These are my fellow colleagues in Fullerton Health in the region. And I was on a call with Philippines yesterday. Very interesting to hear that they were talking about in the Philippines phase 6. Phase 6 in the Philippines is opening to the general public and corporates, individuals. They were looking at that in Q3, Q4 this year to start. So while I can't say for sure when it will be complete, I would say the momentum to start is there.
Okay.
It's there in the Philippines. A little bit behind in Indonesia. Certainly there in Malaysia, which has started already. So I think the ball has started to get rolling.
Right, and there's a growing sense of urgency.
Yes.
So I'm getting feedback from here that you are quite soft. So I wonder
yes.
if we can.
Sure.
I wonder if we can move your mic. Can somebody maybe help
Oh, no
the
worries.
doctor move his mic up further? And you're a bit soft to our virtual audience. Like I can hear you. And so far, people, it's been good news that he's been sharing,
Yes.
and that there's government urgency to get vaccinations rolled out. So, as a layman, I understand the objectives of vaccinations
Yes.
are, one, to prevent infection and serious illness despite exposure to infected persons.
Yes.
And then two is to prevent infected persons transmitting to others, right?
That's an interesting point.
So this is the questions I want to ask. Data from Israel suggests that Pfizer and Moderna are effective on both fronts, right? How much more data is required before a determination can be made?
Well, I think in general, just to share, right, for the audience, basically most vaccines would reduce the viral load. And the viral load really is the one that determines the risk of transmission. So there is emerging data for Pfizer, for Moderna, that there is likelihood of reducing transmission post-vaccination. Now, in terms of the amount of data required, it might be a few more months before we have conclusive data out on a definitive reduction in the transmission risk. So it's looking optimistic, it's looking probable, but we would probably require a few more months of data to have some conclusion around that.
So you guys are basically watching Israel and
We're watching
Dubai
Israel.
right now because they are
That's
way
right.
ahead of the curve, right?
That's right.
Okay, so you talked about 200,000 people in Singapore now.
Well, that's just my organization alone. So we've actually hit a higher number than that as a
Okay.
nation.
All right. So what proportion of the Singapore population would require vaccination before we allow vaccinated travelers to arrive with little to no
Yes.
quarantine?
Well, basically, we're looking at the concept of herd immunity. Herd immunity generally is about 60, 70%.
Okay.
But one interesting point I want to highlight is that currently in most populations, there is a chunk of the population which is the teenagers, the children. So the vaccines now are 16 and above for Pfizer, 18 and above for Moderna. That chunk of the population also is part of the herd immunity. So we do have to vaccinate quite a significant chunk of the adults to get to that 70%, because bear in mind that we can't vaccinate the younger children.
Right. So are we looking at July?
The government initially was looking at end of Q3. I think there is, we are involved in a vaccination effort. We're currently running 8 vaccination centers. Should be increasing by a couple of centers in the months to come. And we are quite optimistic that the initial projection of end Q3 for Singapore could be brought forward.
Okay, so we were projecting NQ3.
It could be
brought forward,
yes.
where we can actually open borders to allow
Well,
travelers to come in without
NQ3 in
quarantine.
terms of getting to that vaccination of the population. So probably around, looking about bringing forward earlier towards middle of the year to get to that herd immunity and that vaccination level in Singapore. I think there's cause for optimism there, because the throughput, number of jabs are getting through to Singaporeans is going at a very healthy pace.
Okay, because it is vital that Singapore
Yes.
allows travelers in, right?
We were talking to some of the ministries and regulators, and they characterize it as such, right? The ports are like our heart, the airlines and the airport are like our lungs. So these are vital organs. So I think that's how we see it from healthcare as well. So these are also vital. These are all vital channels for the economy.
Right.
And I think Singapore actually can play a big role in showing that the different pieces of the puzzle work. There are smaller scale events like the e-gamers conference. There is a push to get the World Economic Forum out. So I think there is a chance to show that with the right pieces in place, travel passes, whichever travel pass it is, right? Pre-departure testing, on-arrival testing. Big events, you still may have your daily or alternate day testing. So there's a chance to put all the pieces together, have a flagship event. It can ensure that it can be done.
A mix of testing,
Pre-departure, vaccination
Okay.
as well.
Right. So as you heard just now, we have like 25
Yes.
passes out there,
Yes.
travel passes and all that. So how do you, as a medical practitioner, look at this, and how are you communicating to governments as to
Yes.
which pass they should be going for?
Look, to be very honest, the pass is important, but equally important is making sure that access to vaccination. But also, I think that there will continue to be pre-departure testing. So the PCR test will remain the gold standard for the months to come. It's important that the providers who are delivering this, be it in Singapore or in the region, are reliable. They work with reliable labs. You have a fast turnaround. And whichever pass is being used or whichever technology is being used, it is, as long as it's easy for the provider to use as well. Bear in mind that these are clinics, these are hospitals, these are nurses entering the data. It has to be easy to use, and if that's the case, that's a good pass to us.
Right. And you were involved with the IATA Travel Pass pilot, weren't
Yes,
you?
that's right.
Okay.
So that's been really a good opportunity.
All right. Any lessons that you learned from that as to how complicated maybe the airline system is?
Well, I think.
What can airlines do better?
Well, I think the airlines that we have in the region are all quite forward-looking. We partner with SIA. SIA has been a leader in the technology sphere. I can't say there's been any complaints about technology. Our clinic staff were trained up quite fast, easy to use. I think what's important is that we make sure that there is a network in the region where providers like us are equally trained up in how to use the platform. So here in Singapore, equally in Southeast Asia, in Asia Pac,
Right.
they need to know how to use them.
So right now, Subhash was saying that actually the issue is governments, accepting these passes as ways to kind of unlock it, right? So do you know of any sort of government-to-government action right now to establish standards and protocols?
Well, it's interesting, right? I see it, number one, globally happening by blocks. So the EU has an initiative going on. I see it happening bilaterally in terms of, for example, Singapore, Malaysia. There are these things happening. But I do feel that for ease of use for the consumers, my personal opinion, as also a consumer myself, is through the airlines is not a bad way. It's actually quite a seamless way to do it. Through the airlines, with support from IATA, I think this gets it in the hands of the consumer easily and in a user-friendly way. So I do feel that there's an approach there which is really driven by the commercial sector.
I'm just checking if there are questions coming in as well, so I'm trying to be, multitasking.
No problem.
What advice, you can sense that the travel industry has been in dire straits. You as a traveler not been able to travel as well. Like, what advice would you give to, the travel industry, and how many more months do we have to wait? What do we have to do to kind of help governments open borders?
Well, I think what has been happening, and I think this is very, very important, is the continued education. From the very beginning, I think in terms of safety to travel, precautions taken in the airplane itself, the customer experience before checking in the flight, post-flight, these are things that are assurances to the passengers. I was going to say patients. These are the assurances to the passengers. And
we are all potential patients right now.
So these are the assurances to the patients that when travel resumes, that the precautions are there. And I do feel that the industry has done an excellent job. I would say hang in there. I wouldn't be so bold as to say that it would resume across the board, but I think between geographies, perhaps Singapore, Australia, New Zealand, Singapore, Malaysia, Singapore and the region, I think there are point-to-point bilateral arrangements which could be really quite safe to travel. And I think the crux of it really is that Singapore bringing in international events, also another cause for confidence.
Right. So you heard him, right? Hang on in there.
Yes.
So I'm going to put you on the spot here. And
Yes.
we've got lots of bubbles being talked about right now.
Yes.
Singapore, Australia, Singapore, Bintan, Batam, Singapore, Taiwan.
Yes.
What would you bet would be the first to open without little to no quarantine? Which one would you suggest that I book a flight for right now?
This is quite risky. But I would say Singapore, Australia has a good chance. That's my view. Talking to some of our colleagues in Australia, I think they are doing vaccinations as well. I think we are sort of on par in terms of control levels, and there is that confidence, that stability. I think other advanced economies have had that approach as well, that push, but the issue is that you have to maintain low community rates for a while, and Australia has contained rates for quite a while.
Right. So it's been interesting in travel too, and we have the Minister of Tourism for Maldives coming on later after this, And Maldives is interesting. Like it reopened July 15th.
Very much so, yes.
Kind of stayed open throughout the pandemic.
Amazing.
Able to manage the COVID cases, What did it do right? What can destinations learn even after the vaccination to manage this?
Well, I think this shows, and it's really credit to the government in the Maldives, that if you get all the ducks lined up in a row, pre-departure testing, on arrival, you have your logistics right. I think the topography of the Maldives also lends itself to it.
Yeah.
Arrive at the airport, bypass the city, go straight to the resort. I think they've gotten the whole end-to-end process, down to exact science. So credit to them. I think it shows that it can be done. But I would say there are some interesting aspects of Maldives, which is the island nature of it. People go straight to the resorts, which are rather unique to that setting.
Yeah, in which case then, we can talk about Indonesia, because there are lots of private islands in Indonesia, right? They're very close to us.
True enough. I mean, archipelagos, that might be an option.
All right. So when do you think you'll be able to travel again? Are you going to go with Australia as well, or you said Hokkaido?
Well, I think some of us, myself included, we've gotten the jab. I've gotten my second dose already. I am thinking, and my colleagues are thinking, that it might be towards later part of second half. Some business travel might be possible.
Right.
So
and do you think that you will travel like you used to for business travel, or are you kind of happy now behind the Zoom screen?
Well, Zoom is something you can take in moderate portions. So I think it's been a while. So we do have to reach out to our colleagues in the region. There is pent up demand, even for business. That FaceTime is important. So it's an overdue as well. So I do foresee that moving into second half of the year, even for ourselves in healthcare, we do want to reach out to our regional counterparts and our business partners in other adjacent areas like insurance and other similar areas are also pushing to work with us, get the vaccination, and hopefully unlock the doors to travel in later part of the year.
Yeah, I mean, I think one of the biggest, learnings from COVID is just the collaboration that has happened across the
Yes.
world, and in travel, we've seen it, airlines working with hotels. And I
Oh, yes.
think in the scientific and medical community, it's just been amazing how you guys
It's
have
been
worked
it's been
together.
critical. It's been critical. I mean, even just to get the vaccines into the markets, the airlines had to play a big part. And Singapore, it was SIA, and even for us in healthcare, I would say that, I mean, not forgetting there is medical tourism as a segment. So we're all linked somehow. So it's not just healthcare, it's not just tourism. I think we have seen the whole ecosystem come together, and that's been a great thing to see.
Well, it's fantastic to have you at a travel conference.
Thank you.
I wish you, when you fly again,
Yes.
right, I will be with you in the next seat, okay?
Thank you so much.
Thank you
for
so
having
much,
me.
Doctor. Thank you so much for joining us.
Nice to meet you.
Thank you.